I think we all, including me, can look at our lives and go, hey, where can I be a bit more congruent to what I believe, what I know, and what's best for our patients and for our community. Hello and welcome to AMC. Today we're going to do something a little different. I had a call recently with a doctor who was talking about their staff and how they were consistently either showing up late or showing up right before it was time to see patients. And I thought about that for a minute and I asked the doctor the question. I'm like, well, doc, when do you show up to the practice? And there was some awkward silence for a minute or two. It was more like about 10 seconds, but it felt like a minute or two. And he said, well, I get there right before I see the patients. And I didn't have to say much more than that because he knew, just like, if you've had children or you've been around children, they will follow the parent's lead for the most part. So that's exactly what this staff was doing. The doc was expecting his staff to do something he was not willing to do. So he was out of congruence with what he said he wanted and what he actually did. So today, I hope this finds just as a gentle reminder in your world, as well as in my world, to ask yourself the question, how congruent are you to what you say, to what you do? And believe it or not, if we're talking about staff, they're watching you, patients are watching you, people in the community are watching you. I know that seems unfair or that seems like more pressure, but it's just true. So ask yourself today, how congruent are you to the messages that you're delivering? And it could be, in your recommendations to patients. And flip this over for a minute. I always ask the question, if we're talking about treatment schedules or what would be best for patients, I ask the doctor and I'll go, well, what would you recommend for your family, for your very, very close friends, people you care about deeply? What would be your recommendations? And it's often not the fact that they're recommending more than what the patient needs. Normally they recommend less based on what the doctor thinks the patient will do. So just right there, they're out of congruence with what they maybe know the patient needs or what they would recommend for their family and what they actually recommend for their patients in their office based on perhaps what they think the patient will accept, maybe what the patient may afford, and now their recommendations are not congruent with what they know to be true. Hope that's not you, but if it is, hey, that's an area that we can become more congruent. Lifestyle is another area in the practice. Again, we're a public figure. Whether you like it or not, we're in our community. People are watching you. So if we're health-minded and health-conscious, and we recommend certain health, things for our patients to do, and yet we're out in the community doing the exact opposite, there's some incongruency happening there. And it may not be something that you can tangibly see, but it is slowly and surely degrading your communication, your messaging, your respect in your community and to your patients. So this isn't a beat up on you, because I think we all, including me, can look at our lives and go, hey, where can I be a bit more congruent to what I believe, what I know, and what's best for our patients and for our community? And when you do that, when we're convicted and we're congruent with our beliefs, our passion, our conviction just come up. And whether you know this or not, when that happens, that's very attractive. And that's attractive to people coming into your office, for the patients that are there, and for the referrals and other people in the community to seek you out because you are a health leader. You recommend the best. So that is a component. The other factor is when we have that belief and that conviction and we're congruent, our respect and our value goes up. And when that happens, believe it or not, compliance inside your office goes up. So this is just a reminder, I think more for me today, but hopefully you get some benefit as well, is to look at your daily activities, your daily messaging, or what some people would call marketing, and marketing is just messaging, communicating with others, and see how congruent it is to what you know, to what you believe, to what you're convicted on, to what you're actually showing and displaying, whether that be to staff, whether that be to patients, or whether that be people in your community. I hope this is a blessing to you. Take it, run with it. As passion and conviction goes up and respect and value go up, nothing but good things happen for that practice, for your community, and for your patients. If you've received some value from this, you know what? Follow us here on this channel, subscribe, and also jump over to amcfamily.com. You can connect with us, and if you need more of this in your world, click have a consult, and we're happy to communicate with you to see what can be done, because we're here to help you. Have a great day. Be blessed.